Nurse Practitioners Shaping the Future of Healthcare. Presented by Heather Badger, Ryan Inglis, Carrie Fugate, Lindsay Gray, Karina Montesa Morlan, Jamila Una, Kate Whittaker, and Karen Weintier. This presentation is dedicated to Loretta Ford and Henry Silver, co-founders of the nation's first nurse practitioner program in 1965. Without them, we would not be where we are today. Fact: 60 million U.S. citizens live where access to healthcare is limited. Fact: many reside in sparsely populated towns with no doctors, while others live in cities but use hospital emergency rooms as their primary source of healthcare. Fact: the Association of American Medical Colleges predicts a future shortage of greater than 20,000 primary care providers by the year 2020. So what is the solution? Nurse practitioners. What is a nurse practitioner? Well, nurse practitioners, or NPs, are registered nurses with master's or doctoral degrees who are specially trained to diagnose and treat illness, give physicals, prescribe medicine, and refer patients to specialists. Nurse practitioners. These providers offer an appealing blend of holistic clinical expertise, health management, and disease prevention, as well as a comprehensive angle to healthcare and utilization of evidence-based practice. So what makes nurse practitioners unique? As licensed independent providers with a blend of medical and nursing preparation, NPs are uniquely qualified to provide the patient-centered care that is central to meeting the existing and future primary care needs of our nation. Now let's take a look at the foundation of nurse practitioners. How did this profession come to be? Early in the 20th century, hospital-based courses were developed in the areas of anesthesia, OR, and obstetrical nursing. During the 1930s, the Frontier Nursing Service began serving the healthcare needs of rural Appalachia with minimal physician oversight. Following World War II, we saw the development of the clinical nurse specialist role and the implementation of the Nurse Training Act. Then, in the 1960s, medical specialization created a national shortage of primary care providers. So Loretta Ford and Henry Silver at the University of Colorado developed the nation's first nurse practitioner curriculum. This caught on, and by 1973, 65 nurse practitioner programs had already been implemented nationwide. During the 1980s, these programs continued to grow, and by 1989, over 90% of these programs granted master's or postmaster's degrees. From 1990 to 2010, nurse practitioner numbers continued to climb, and nurse practitioners began branching out into specialty areas as well. By 2010, over 100,000 nurse practitioners were practicing in the United States, surpassing roughly 70,000 practicing physician's assistants at that time. In the year 2017, there is an estimated 230,000 nurse practitioners practicing in the United States, and this number is expected to continue to grow. Let's take a look at the educational path of a nurse practitioner. The first step to becoming a nurse practitioner is to obtain a nursing degree. This can be accomplished through an Associate of Science in Nursing degree, which combines didactic and clinical courses and requires that nursing candidates pass a National Council licensure examination for registered nurses, or the NCLEX-RN. These nurses must then further their education by obtaining a Bachelor of Science in Nursing. The bachelor's prepared nurse must then apply to a university program which offers a nurse practitioner concentration. This can be accomplished in two ways, the first of which is a Master of Science in Nursing. This requires an additional 2 to 3 years of combined didactic and clinical hours, 500 hours of didactic instruction, and a minimum of 500 hours of clinical instruction. Nurses seeking a terminal degree can apply for a doctorate of nursing practice, which will require 740 hours of didactic instruction and a minimum of 1,000 hours of clinical instruction. These nurses must then pass the nurse practitioner certification exam and are then required to complete 75 continuing education hours every 5 years in order to maintain their certification. So what exactly are nurse practitioners able to do with all of this education? Nurse practitioners' scope of practice is defined by individual state nurse practice acts, which establish guidelines and perimeters for safety and professionalism, and have the potential to evolve as updates to scope of practice occur and amendments are needed. Each state legislature passes laws regarding safe practice and professionalism, and they are managed by state regulating agencies, such as the State Board of Nursing. These agencies determine who, what, when, where, how, and why nurse practitioners are able to treat. There are 7 key nurse practitioner abilities that define the scope of a nurse practitioner's practice. The first is autonomous practice. The second is their ability to serve as a primary care provider. They are also independently able to prescribe Schedule II drugs, order physical therapy, sign death certificates, sign handicapped parking permits, and sign workers' compensation claims. Unfortunately, some states do not yet allow nurse practitioners to practice to the full extent of their education and training, but these restrictions do vary by state. In full practice states, nurse practitioners are licensed to evaluate, diagnose, order tests, interpret those tests, and manage treatment with medication prescriptive authority. In reduced practice states, licensure law denies nurse practitioners full practice in at least one of the elements of usual nurse practitioner practice, and collaboration is required with outside healthcare disciplines. In restricted practice states, there is restriction on the nurse practitioner's ability to practice in at least one of those elements of usual nurse practitioner practice, and it requires delegation, supervision, or team management from outside health disciplines as well. This map shows which states allowed full practice, reduced practice, and restricted practice in this nation as of the year 2013. This updated map from 2017 shows that nurse practitioners have been granted full practice authority in several additional states, and this trend is expected to continue. This graphic shows a breakdown of state practice laws for nurse practitioners by area of scope of practice. As you can see, the Northwest region of this country allows for the most independent and full practice for nurse practitioners, while the Southeastern region still restricts nurse practitioners in a number of areas of their scope of practice. Let's take a look at what the future holds for nurse practitioners in the United States. There is a primary care shortage in this country, and the current number of practicing nurse practitioners is still increasing. In 2014, over 140,000 NPs practiced in the U.S. versus only 106,000 in 2005. This growth was in response to the expected medical doctor shortage in the U.S., and the Health Resources and Services Administration projections indicate a shortage of 20,400 physicians by the year 2020, and this shortage could be reduced to only 6,400 with effective integration of APRNs and PAs into the system. Nurse practitioners can help to change healthcare for the better in a number of ways. First, utilization of nurse practitioners within the rural healthcare setting will help to ease the burden brought about by a shortage of MDs in these parts of the country. Nurse practitioners also have a reputation for excellent patient satisfaction, as well as provision of the same quality of care and increased preventative education when compared with MDs. Less strenuous scheduling allows nurse practitioners to provide increased chronic illness education as well, and the demonstration of a holistic approach versus the medical model of care is appealing to many patients. Nurse practitioners can also help us to reduce emergency room wait times through the utilization of nurse practitioners in fast-track settings. This use of nurse practitioners is associated with overall better patient satisfaction and has no effect on the quality of the care provided to these patients. There is clearly sufficient evidence to support the use of nurse practitioners within the primary healthcare setting in this country. However, there are some barriers that stand in the way. The biggest issue for nurse practitioners are the scope of practice restrictions previously discussed and the limiting of a nurse practitioner's ability to prescribe medications. The Institute of Medicine report indicates that nurse practitioners should be free to practice to the full extent of their education and training, but this will require state and federal law changes to expand the scope of nurse practitioner practice. There are some differences in the utilization of nurse practitioners abroad, and nurse practitioners are performing surgery within the King's College Hospital of South London, which is a division of King's Health Partners Academic Health Sciences Centre. This is the first United Kingdom hospital which allows surgery for selected kidney patients performed by specially trained nurse practitioners. And we will likely see this type of utilization of nurse practitioners within the United States in the future, given the current climate. The implementation of the Affordable Care Act placed renewed emphasis on primary care and focused on the need for additional primary care providers. Nurse practitioners were identified as providers in multiple sections of this legislation, and the Affordable Care Act provided funding for several nurse practitioner-specific programs. This allows for continued expansion of the use of nurse practitioners within the United States. The future is now. There is a predicted shortage of primary care providers in this country, and nurse practitioners can help to alleviate this shortage. Your nurse practitioner can offer you a unique perspective that is both medically sound and holistic in nature, and nurse practitioners provide high-quality, evidence-based care and preventative education. There are endless opportunities for nurse practitioners to guide healthcare changes in this nation as well.